Welcome to Your Family's Health. This is Joan Buckley from the Department of Nursing here at Nassau Community College. Your Family's Health is a program that focuses on the issues and the healthcare resources here available to you in Nassau County. On the show, we speak to experts from around the country, and we keep you up to date on current healthcare issues and trends. And today we're going to be speaking to Nicole Chimento and Tina Wolfe. Tina is the Executive Director of the Community Action for Social Justice, and Nicole is the Deputy Director of the Community Action for Social Justice. And the topic today is going to be overdose prevention and the use of Narcan and its role in saving lives. So if you want to know more about how to stay healthy in Nassau County, stay tuned for the next half hour to the voice of Nassau Community College, 90.3 WHPC. So welcome to the show. That was a mouthful. Now I'm exhausted. Nicole and Tina. So welcome to the show. I really always like the listening audience to get a little feel for who you are and how did you get into this positions or both positions in the community action for social justice. I mean, what's social justice? Can either of you give me a good definition of social justice, and how does community action play a part?
I feel like we work on one portion of social justice, and we focus on, our target population is people who are actively using drugs. And so for me, social justice for them is about humane treatment sort of in all walks of life, regardless of the fact that they're using drugs. And so we work with larger structural systems, healthcare systems, legal systems, to make sure that people are sort of given a fair shake, given their human rights. On a more micro level, our day-to-day work is about helping people take care of their own health. And so through our syringe exchange program, which is the only one on Long Island, we make sure that people have access to clean syringes. They have access to safe disposal of those syringes so as not to endanger the rest of the community too. They have access to safer injection equipment. And we take them to detox and drug treatment when they're ready. Of course, the big one that we're talking about here is Narcan, or overdose prevention. People have to be alive in order to do better or take care of themselves and their families and communities.
Now, you both look so young to be involved in something that is so important today and reflects the climate of Long Island. So now, Nicole, you look very young as well. How did you get started? This is not your first community engagement position. You've been active for a while. Can you tell us a little bit about that?
Yeah, absolutely. So I have a background in public health. I went to school for public health for my undergraduate and graduate. And then, like any student, was scrambling to find a job, applying everywhere. And I call my falling into this position a act of fate, honestly. I applied for a position, wasn't sure what it was. It was called Director of Harm Reduction. I just figured it sounded public health-like. Applied for it, got it. Found out it was syringe exchange and fell in love with it. And through that, it wasn't Community Action for Social Justice. It was a different organization that was around at the time. I met Tina, and from the beginning, Tina said, we're going to do big things together.
So who's your support?
Who's my support?
Oh, you are each other's support. And if you go to the website for the Community Action for Social Justice, it looks like a lot of support. I mean, everybody there seems very specialized. They're all public health awareness is huge. And it actually was very interesting because it didn't look like anybody overlapped it really as their professions. But when you put you all together, it looked like a real power team. So could you tell us a little bit about the team for the Community Action Social Justice?
Yeah, so I have the really unique privilege of working with these guys, and I'm so grateful that we've had this opportunity and that CASJ has become what it is. And when I started CASJ in 2013, I was by myself, and it was just me. And Nicole came on board first, and then it was kind of me and her doing our thing. And so over the last 4 years, CASJ has grown because the need is here, right? We have a lot of people on Long Island who actually need the services that we're providing, so we don't have to sort of work to find a niche. Like, it's here already, and we work to meet that existing need. And so we've sort of added to our team over the last 4 years, both in terms of paid staff and in terms of volunteers too. You asked earlier about community.
Yeah.
And I feel like all of our work is very much informed by multiple facets of the Long Island community, whether it be people who are actively using drugs, or their friends, their family members, their loved ones, the families of young people who have passed away from drug overdoses are very much involved in our work. So we've got the five of us now who, you're absolutely right, we're all so different.
You really are.
And we're like, I don't know, this crazy team. Our office is sometimes a crazy place when we're all there. Crazy personalities. And I work very much off of a strengths-based model in terms of my staff. I think that's our differences, our diversity is what makes us a good team. And the same thing with the community.
Yeah, and it's often that something awful that's going on brings out something really wonderful. So I really appreciate this. Now, you made the comment about paid staff. And who pays the staff? Like, where does the income come for this?
The whole organization is supported by the New York State Department of Health. They pay for all of our direct service. And then we get some private foundational funding from AIDS United. A lot of it is HIV prevention efforts around access to clean syringes and making sure that people aren't sharing and that they know how to take care of their own health. But, of course, we get support from the community, too. We don't seek local funding. Just because what we do is still kind of politically and socially controversial. But people...
Well, it has a certain amount of stigma to it.
Absolutely.
Mm-hmm.
And so, I respect that people don't necessarily want their tax dollars going to directly to the work that we do, but people who do value the work that we do contribute in a lot of different ways, both with their time and with their money.
Now, the way I see the services, and I see two of them that kind of are preventative, and as a healthcare provider, I like to prevent problems, right? So, and I know the syringe exchange is a way of preventing it, but what's this risk reduction, counseling?
So risk reduction education is a big piece of what we do. A lot of people think as a syringe exchange program, we just go give people supplies and say, have a great day. But that's such a small part of what we do. We actually speak to them about, how to make sure they're being as safe as possible until they're ready to make different decisions, if that's ever what they're ready to do. Because we're harm reduction, we don't push anyone in any certain direction. But if they identify that they're ready for a detox, a treatment, methadone or buprenorphine, we'll make sure that we hold their hand as tightly until they get that service as they need. With the risk reduction education, we talk about HIV testing, STI testing, hepatitis C testing. If they know they're hepatitis C positive, we talk about treatment options with them. We talk to them about abscess care. We talk to them about, safe injections on the site, making sure they're taking care of their skin. And again, just being as safe as possible until they're ready to make different decisions, if that's ever their choice.
If it's ever their choice.
Right.
And sometimes that's accepting them from where they're coming from, right? Accepting
Absolutely.
them for what they present as. Did you ever have an opportunity to, and this again, because of the stigma associated with drugs and the fact that you're a community action that's swapping syringes, it could look like you're swapping clean for dirty syringes, and you don't insist on people trying to get clean or whatever they're doing. Do you ever get invited, say, to a high school or some place that's considered really pre? And I know we have huge drug prevention programs going on in the schools, smoking, alcohol, and drugs. Clearly, we're bringing them to the high schools because we know it's there. But are you getting any invites from the schools saying, we think we have a problem, and or no?
We've always been active in schools.
Good.
Normally it's after-school type programs, evening sessions with parents, and we've worked with police for 5+ years doing overdose prevention trainings at schools where they're open to the whole community. But it's on a voluntary basis. It's not directed at the kids necessarily. And I think sort of what we do is a little bit nuanced like that. We work with people who usually already have some problems. And I'm keen to let the prevention people do what they do, and we do what we do. Because, lots of people have histories of drug use themselves. And I would say, for me, personally, the battles, the struggles that I've had to go through to get where I am. And I don't regret those. And so I wouldn't be in a position to tell somebody that they shouldn't necessarily do anything that feels along their path for life. But
so
I think
that would be someone
acceptance-
else on the team, someone in the schools. I totally agree. And I mean, we were talking about the Narcan and the idea that if these evening programs for people that are interested in hearing about what you have to offer, they could just inform one person, and one person could save one life. That's in itself. How much more do you want to do for anybody in your job, right?
Right.
But you guys do an incredible thing. So, drug overdoses. Do you have any statistics on the drug overdoses that occur here in Nassau County?
You wrote down numbers, didn't you?
Oh, did you write down numbers?
Hold
on.
Give
So
me just one
we're
second.
kind of.
Well, does it
there
matter?
are other folks that do statistics. Yeah, we live by sort of our experience and our firsthand experience. And I think part of what CASJ does, because we are the only organization that specifically works with active users on Long Island, is that, I don't know, to me, everybody is important. And I hate turning people into numbers. I think the work that we do specifically, like you said, starts from acceptance.
Mm-hmm.
And it starts from treating every person as a human being. And are there statistics? Yeah. I mean, I think that, overdoses are actually down this year from last year, according to
Statistics.
But
Yeah.
again, the stats that we do have don't tell the whole story. Like, there's statistics on how many people have called 911. And what CASJ gets, and the really cool thing about what we do, is that a lot of the people that report overdose reversals to us don't actually call 911. So the things that we see are things that aren't even picked up in official statistics. Because they don't feel comfortable calling 911. We get those people, like I said, we're kind of nuanced in that way. We get those people that don't really talk to anybody else, that have already lost those support systems, that really have nobody else in their lives, and we get to be that for them, which is an important place to be. I see the work that we do sort of as that safety net for people who would otherwise have completely fallen through.
No, I totally agree. You went to get some statistics. Do you have any statistics that would be meaningful?
Yeah,
because
so,
I totally believe what Tina say is true, that you are not capturing the group that is recorded.
Right.
And when there's something attached to a stigma, mental health or whatever, you often don't hear about the real problem. It's only someplace when they check into a hospital, or there are statistics for in a police department's call or something like that. So I totally understand it. But do you have any statistics? You must have some statistics that warrant your organization. I mean, or you wouldn't be so successful.
Yeah, for our organization, I mean, last year alone we had 98 reversals, all successful, fortunately. And of those 98 reversals, 96 people were active users saving their friends' lives.
Wow.
So, I mean, that's always a cool statistic that I tell people, because a lot of the, pushback we get sometimes is, oh, you're giving Narcan to active users. Aren't they going to push the limits and abuse it? Any active user doesn't want Narcan because it puts them in immediate withdrawal. Everyone who uses know what it means. And even sometimes when we're doing an intake and I'm like, oh, do you need Narcan? They're like, whoa, no, what? And I'm like, no, I mean, like, to have in case a friend overdoses, I'm not going to Narcan you. And they're like, oh, okay, yeah, no, that'd be great. So providing it to the people who are actively using is actually the best form of harm reduction, because they're the people who are around others who are using, so yes, we're giving Narcan to people who are actively using because they're going to save the lives. Doing community trainings are great, but over the 5,000 people we train every year, we get maybe one reversal report, maybe two.
You mean the Narcan in my cabinet? Probably I will never use.
Exactly.
It's
That's probably
exactly
expired.
It's expired. Yes,
right.
it has.
Exactly.
It's okay.
Now, there was some, and I don't know, but if you go back a couple of years, I met a woman, and she was doing the 911 Don't Run, and that's where I first started hearing about the Narcan, and the county was starting to also push education for people to have it. And in college campuses, it's huge, because you could come across a student that may be overdosing. You have to be around the clientele.
Right.
Like you said, you have to be around people that are using in order to really have it be effective. The awareness piece, and mine has expired. You are absolutely correct. It's been sitting there probably for 5 years. But, you just, it's kind of an awareness thing. If you're aware of it and you know it and you touch it,